Many of us have heard about ADHD, attention deficit hyperactivity disorder. Initially first diagnosed in childhood, but it can last into adulthood. It's a mental health condition that affects a person's ability to focus, sit still, and control impulsive behaviors. As a result, one's quality of life can be affected. But with proper education, treatment, and support, adults living with it can manage and thrive. On the program today, we'll discuss how to diagnose ADHD, its misconceptions, and how to manage it. I'm Dr. Freddy Gomez, and this is Med Talk Health Talk only on CNN Philippines. ADHD often goes unrecognized throughout childhood, but the more responsibilities we have as we get older, the greater the demand on our capacity to focus, stay organized, and be reliable. This is why it's important to diagnose and treat the condition as early as possible. Let's welcome our guests for today. With us is Dr. Corazon Angela Cuadro. She's an adult psychiatrist from the Medical City. Also with us is Dr. Angie Sievert Fernandez. She's a child developmental psychologist from the St. Luke's Medical Center. Dr. Quads, tell us what it means for adults with ADHD to lack focus, because it's a bit more than just finding it hard to listen in class or to listen to a speech, isn't it?
In adults, we usually see manifestations in terms of impulsivity, irritability, a difficulty focusing, maybe some restlessness, a little fidgeting over here and there. So that's the typical presentation of ADHD in adults. And of course, in terms of how that manifests in the adult life, then that will be seen in occupational functioning, academic functioning, social, in relationships, in activities of daily living like managing of finances, chores around the house, the daily grind.
Dr. Angie, could you tell us how it would manifest within a child? At what age would one expect this type of condition to be seen, and how would this progress?
What is important for people to understand is just because makulit, malikot, doesn't mean may ADHD na agad. There are things that we have to be looking at also. Okay, how many of these symptoms do they manifest? They have to manifest as children at least 6 of the listed symptoms. Plus, it has to occur in 2 settings. Hindi lang sa bahay, hindi lang sa school, hindi lang sa parties, but at least in 2 settings, it occurs consistently. Okay? Kasi minsan, Dr. Freddy, may tendency na hindi nakafocus, malikot, ay may ADHD yan. But it goes more, it goes beyond that.
Aside from some of the symptoms that you mentioned, how ADHD can present in adulthood, are there other practical applications where we could see that there could be a possibility of a diagnosis of ADHD? Let's go with, let's say, for example, career choices, or maybe how well they have stability in their life. Could this be a telltale sign of ADHD?
You know how sometimes there are career choices that don't fit that. So there would be obvious bothersome symptoms that way. For example, some find that they don't fit well with some patients with ADHD find that they don't fit well with a desk job. Some find that they thrive more when they are out in the field. Halimbawa lang po yun . So maybe that's an example.
How would someone know the difference between maybe just a plain behavioral problem and that of ADHD? So how would ADHD in an adult be diagnosed?
It would be worthwhile to go for at least an initial evaluation. Say with your trusted psychologist, psychiatrist, family doctors. You know what we work with often? School guidance counselors, college or university faculty or administrators, and human resource staff, because they do pick up some of the possible symptoms that would warrant at least an initial evaluation or screening.
What are some of these factors kaya that could affect someone to develop ADHD early on?
The research will tell us that genetics might be is a factor. There's a genetic link when it comes to ADHD. There are, let's say, associations, causal associations, we call it. Like, for example, maybe between alcohol use during pregnancy and all of these things, no, or premature birth, or exposure to lead paint in childhood. These are some things that may be causal, but are not definite yet.
And when it comes to managing or lessening the exacerbations of the symptoms, Dr. Angie, would you say that it is somewhat more beneficial if the ADHD was spotted earlier?
It's always best to diagnose it early. It's always best for early intervention to be provided to our children, because when the people involved in the care of the child have a better understanding that this is something the child has no control over, then it changes the way they relate to the child. Okay, and then it also teaches the child, when you catch it early, you can also make the child be aware of what are the difficulties that he is experiencing. What are these? You can tell them directly what they are. Then you can help the child manage it. Ang nangyayari kasi, Dr. Freddy, and over the years of, working with children with ADHD, there can be damage done over the years if this is not caught early. So, for example, sasabihin, ang kulit-kulit, nakakainis talaga, hindi marunong sumunod, interrupt. And so the child gets name-called, the child gets ostracized. It can affect relationships. So imagine the impact of that on the child. If the child just thinks, siguro magulo lang ako, kung hindi niya alam. So there can be repercussions when it is diagnosed at a later age, and also because interventions are not provided.
Now, symptoms of ADHD can make life difficult for the adults living with the condition. We'll discuss these challenges after a short break. Stay with us on MedTalk Health Talk. You're watching CNN Philippines. From work to house chores and raising a family, life can be overwhelming for many of us. But these aspects of daily life can be an even bigger struggle for adults with ADHD. Today, we'll discuss the complications they face and some of the misconceptions of the condition. I'm Dr. Freddy Gomez. Welcome back to MedTalk Health Talk, your partner in healthcare. Dr. Quads, ADHD can make life difficult for anyone. What are some of the complications that can arise kapag adult na ang isang taong may ADHD?
Children and adolescents, and eventually adults, if they don't understand that the experience or the manifestations are actually symptoms of ADHD, they tend to grow up believing, feeling, thinking that they are inferior to their peers, to schoolmates, or to office mates, maybe even less behaved, less obedient, or pasaway.
Parents may find it difficult initially to maybe think that their child may have ADHD. So are there some concrete red flags that they can look at? And one of those things is schoolwork. So what does the performance of a child with ADHD look like?
If a child is predominantly hyperactive, the child will have difficulty staying placed. The child will keep on moving. Okay. However, the child can still do some schoolwork. That means cognitive functioning is also still okay. And then they won't see it masyado as a problem. However, when we are working with children with ADHD, there are what we call comorbidities. Some things are likely to happen more with children with ADHD than others. And so what are some red flags? Learning disabilities, that can be one. Okay. Low, sort of like low self-esteem, the way they see themselves, more likely to develop mood disorders, for example, like being sad and depressed or being anxious. These are some things that we can look at also.
Dr. Quads, let's clear something up, starting with a misconception that ADHD isn't a real condition.
It is a medical condition. It is a the most common neurodevelopmental disorder. And we do have diagnostic criteria like Dr. Angie mentioned.
Now, another misconception is that many believe that people with ADHD just need to try harder. They think that because those with ADHD can hyper-focus on their interests, they can do so with other tasks if they really wanted to. Dr. Angie, could you explain this for us?
I've worked with a number of kids now, and it really breaks my heart because they will say, but I'm trying. I'm doing my best and I can't. And we really have to listen to children. I think that's very important. Listen to your child when they say they're trying and they still can't do it. Because it's not for a lack of trying. It's because it's beyond their control. And when we talk about, Dr. Freddy, about hyperfocus, there are certain environments, there are certain situations that can be highly stimulating, certain activities that can be highly stimulating. And this is when hyperfocus comes in. However, if it's, let's say, the more mundane, less stimulating activities, that's where you see the distractibility really come to the surface. And that's when you're able to say, ay nako, wala, di makafocus.
Now, another misconception is that kids will outgrow ADHD, but many adults are living with this condition. Dr. Angie, discuss this a little bit more with me. Is it possible if a child is diagnosed with ADHD, they can outgrow it?
They do not outgrow ADHD. Again, we said it's a neurodevelopmental disorder. It's brain-based, it's biological. Once you have it, you live with it for life. However, the difference there would be the ability to manage it better. It may not ever go away. However, your capacity to manage it, to live a good life despite having ADHD, can happen.
If you've been diagnosed with ADHD, you can learn to manage your condition and, better yet, thrive. More on this when we return. We want to be your partner for a lifetime of good health. Keep it here on CNN Philippines. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk, where your health comes first. Dr. Quads, I'd like to ask, what are some of the ways to manage ADHD in adults?
When we manage ADHD, we will target, the strategy is also multifactorial, multidisciplinary. So a combination of pharmacologic and non-pharmacologic intervention. So we have medications for ADHD along with cognitive therapy, behavior therapy, lifestyle modification, and enhancing coping techniques. So, combination po siya.
Now, Dr. Angie, we heard how ADHD is managed in adults. Pag na-spot ito early on, is this the same type of approach that you go for kids?
Again, depending also on the severity, we have to be looking at, are the ADHD symptoms mild, moderate, or severe? If it's mild, okay, let's go for counseling, let's go for occupational therapy, let's go for behavioral therapy, let's go for accommodations within the environment, for example, let's go for lifestyle changes, for example, making sure that the child has physical activity, good food, enough sleep, all of these things. However, if it's moderate to severe, and the symptoms are really, there's a high number of symptoms and it affects the functioning of the child, then we also recommend that they see the psychiatrist for possible medication.
Dr. Angie, do we have this type of support system, classes, courses, that can help not just the person who has ADHD, but the families or the loved ones around the individual?
Family education is very important. No? When we do assessments, that's one of my main recommendations, education for the parents and for the other family members, because it makes a huge difference when we understand our children better. And yes, there are opportunities. Like, for example, there's an ADHD organization in the country, and then they have webinars, they have education opportunities for parents, for children, and for siblings, even for teachers and caregivers, other caregivers. So that's possible. Psychological organizations, education organizations, or even medical associations, or centers in hospitals, they have all of these trainings, conferences, and talks for parents that can educate parents. And mismo, us, psychologists, or like Dr. Quads, as psychiatrists, we can also take it upon ourselves to educate the parents and let them understand better how to support their kids having ADHD.
Is stigma a problem when it comes to trying to spot or diagnose a child with ADHD early?
Yes, it is. Because the parents will label the kids generally. Ang kulit, ang gulo, nakakaya naman to. You don't want to bring him to a social gathering. You don't want to, when people are over the house and he's so magulo and he keeps on interrupting. So it matters to the parents and even to the teachers. Because the teachers also have a difficult time managing the behavior and can start labeling, can start picking up, calling the attention of the child more often.
Now let's talk about medication, because this can also be prescribed for adults with ADHD. And studies show that majority of adults with ADHD who take medication have big improvements in their symptoms. Dr. Quads, what are some of the different types of medication available for those diagnosed with ADHD?
The most useful medications for ADHD are what we call stimulants. It might seem counterintuitive.
Right.
So why are we giving stimulants for a hyperactivity disorder? That actually reflects our understanding of ADHD as a medical disorder. ADHD is not a matter of kulang sa focus or hyperfocus. It's precisely that. It's a hyperfocus, kulang sa focus. It's a dysregulation. Okay, or an irritability, yung likot. So generally, it's a problem with the regulation. So accordingly, in terms of medications, our stimulant medications or ADHD medications in general target to help regulate those cognitive functioning.
Dr. Quads, are there any significant side effects that viewers should be wary about when it comes to medications for ADHD?
So you could imagine something like a caffeine effect, palpitations, some disturbance with appetite. Okay, but other than that, I would like to take this chance to address the most frequent concern with ADHD medication, which is are ADHD medications habit forming or addictive? While there may be that risk for addiction, especially with, say, for example, the amphetamine-like substances or stimulants, this risk is very, very manageable. Okay, especially because we work closely with our patients, or our families work closely together. So the risk for dependence is very much controlled and closely monitored.
But I'd like to just remind our viewers that no two adults with ADHD are the same. So don't think that the medication for one, what is prescribed for one, would work on someone else with ADHD. So the take home from this is work with your doctor to find a treatment plan that suits you best, whether it be medication, therapeutic, or a combination of both. Dr. Angie, before we go, do you have any additional tips for managing ADHD?
One of the most important for me, is looking at the child as a child. First and foremost, he is a child. ADHD is just a condition. So he's a child with ADHD. And he is also struggling. He is trying. He's having a difficult time. And what we need to do is understand, listen, and support our children the best way possible. And we can do this by seeking help if we are unable to do it ourselves at home.
And Dr. Quads, any advice for those adults who may have or who do have ADHD?
What we aim to do is to streamline management per patient. And that's what health education or psychoeducation with the family also targets to do. We want to streamline and, as best we can, tailor fit the management for each individual with ADHD.
I'd like to thank adult psychiatrist Dr. Corazon Angela Cuadro and child psychologist Dr. Angie Sievert Fernandez for guiding us on today's episode. I'm Dr. Freddy Gomez, and we'll see you again next time. Stay safe, everyone.